Good evening and welcome to the September 8th, 2025 Grafton Board of Health meeting. As a preliminary matter, this is Jennifer Maynard, Chair of the Board of Health. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Andrew Chalupka.
Andrew Chalupka here.
Bill Muller.
Bill Muller here.
Radhika Prabhu.
Radhika Prabhu, aye.
Staff and anticipated speakers on the agenda, when I call your name, please respond in the affirmative. I don't see Nancy. Let's see. Mackenzie Falker.
Yep, Mackenzie Falker here.
Annette Garcia.
Annette Garcia here.
Bridget Hurley.
Bridget Hurley here.
And just to acknowledge, Connor Robichard has joined us today as well. I'd like to open the meeting. May I have a motion to open the meeting?
This is Andrew Chalupka. I make a motion to open tonight's meeting.
Is there a second?
This is Bill Muller. I second that.
Roll call.
Andrew Chalupka, aye.
Bill Muller, aye.
Radhika.
Sorry, Radhika Prabhu, aye.
Jen Maynard, aye. This open meeting of the Grafton Board of Health is being conducted hybridly, consistent with the Act extending certain COVID-19 measures adopted during the state of emergency. Governor Healy has further extended this act until June 30th, 2027, of the remote meeting provisions of former Governor Baker's March 12th, 2020 executive order, suspending certain provisions of the open meeting law. In order to mitigate the transmission of the COVID-19 virus, the act extends the requirements of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed to participate remotely. The order, which you can find posted at the town's website at www.grafton-mass.gov, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. There are no public hearings scheduled for this evening's meeting. If the public has a question or comment on an agenda item, please utilize the Q&A feature in Zoom. Please include your full name and address when submitting a comment. And I'll just note there is nobody present with us in person other than those already indicated. For this meeting, Grafton Board of Health is convening, as we said, hybridly via Zoom and in person as posted on the town's website identifying how the public may join. Please note this meeting is being recorded and that some attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you and to take care not to screen share your computer. Anything that you broadcast may be captured by the recording. Any supporting materials that have been provided to members of this body are available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda unless I note otherwise. Before we return to the first item on the agenda, permit me to cover some ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. I'll introduce any speakers on the agenda for a topic. After they conclude their remarks, I'll invite the board members to provide any comment, questions, or motions. Please identify yourself by name when speaking. Further, please remember to mute your phone or computer when you're not speaking. Please remember to speak clearly and in a way that helps generate accurate meeting minutes. For any response, please wait until I yield the floor to you and state your name before speaking. If members wish to engage with other members, please do so through me, taking care to identify yourself. Finally, any votes and motions made during this meeting will be conducted by roll call vote. Got a little shorter that time, maybe. Okay. So first on the agenda, and you are welcome to stay after this, but you don't have to. We wanted to give Connor you a moment to introduce yourself and the work you'll be doing with us. Welcome. Hi, Nancy.
Thank you so much. And thanks for the Zoom option. Allows me to jump to another meeting after this.
Perfect.
I'm Connor. I'm the Director of Regional Services at the Central Mass Regional Planning Commission. My team at CMRPC works to bolster municipal services in a variety of ways, and since the pandemic, we've been especially focused on building and supporting local public health collaboratives across Central Mass. So I'm here today to help launch the Central Massachusetts Regional Public Health Department and offer a quick refresher on the grant program that's funding a lot of this work. So I'll be real quick, just a couple minutes.
Sure.
So in addition to your local investment, this team's supported by the Public Health Excellence Grant Program. It's a statewide initiative to build stronger, more equitable local public health systems. The goal is to help towns like Grafton expand access to essential public health services by sharing staff. So that includes the folks in the room with you. and by collaborating closely with your partner towns, Shrewsbury and West Boylston. So we're here to make sure you have the capacity you need while tailoring services to your town's specific needs and expectations. Before I turn it over to back to you and to Annette, I'd love to hear from the board for just a minute to help better understand what matters most here in Grafton. So just a couple questions, and I'd love to get input from the board from your perspective. What public health issues should we be sure not to lose sight of here in Grafton?
So I guess I'll just give a quick start of some of the things that over the last couple of years, we've really worked with the PAST Alliance to kind of rebuild in a post-COVID or coexisting with COVID world here in Grafton that I think we feel is kind of important to try and continue in supporting folks in the community. So the first being we do have some vaccine clinics that we've stood up. With nursing, we're doing some blood pressure clinics, as well as during those clinics, allowing people to fill out like the file for life form, so they have that. Certainly, I think those are things we'd like to continue as much of. We've had a lot of work around our ambulance response times and really identifying different groups within our community that maybe they have some unmet needs in the community, and we can help those communities not have to maybe utilize that service as much by putting services in place. So I think having a clinician out in the field, getting to know people, working with those senior housing has been a couple of the things that we've stood up over the last couple of years that we'd like to continue forth. Bill and a few others are on a subcommittee that we created for the opioid settlement dollars. And we've been really kind of moving some of those initiatives forward. So that's certainly a priority to continue to advance access for support services here in Grafton. What else? Did I leave anything out? Anything else? Or any other priorities I didn't identify?
No, that's fine. That's fine.
That's great. Super helpful. And you mentioned a couple of these already, but any programs or populations that have needed extra attention in recent years? I know you mentioned seniors, ambulance program, the blood pressure clinics have been helpful. Anything else?
I think that's where primarily we've been focused. We did have, sort of during the height of the pandemic, we did support some vaccine clinics at the schools as well. So certainly, there's sometimes some hesitancy, but also if there isn't, we want to help people have access as much as possible in the town. So we've also been working on, aside from the ambulance committee, access to first aid and AED supplies in our schools in particular, but also things like the municipal buildings and places where lots of people congregate. We identified through a separate work stream that everybody's sort of doing their own thing. So we're trying to figure out how to be able to streamline that. Certainly there's certain groups like the fire department and the police that have it down pretty well, but others are sort of on their own. So that is a priority because we do know that people have better outcomes if they have, early access to first aid and AED in an emergency situation. So that is something that we did a subcommittee on. We had to pause a little bit just given some of the things that we additionally had taken on, but September, October, we're going to try and kick some of those discussions back off again. And I think our senior housing, maybe some of our group homes have identified an interest in partnering with the Board of Health and the Alliance to, again, sort of better understand the needs in the community so that people's unmet needs can be better met, whether that's, in collaboration with the Senior Center and the Board of Health, but so seniors and I, think the school-age children as well for that. And then, of course, we do a lot with you all around, tobacco, the tobacco laws. And I know that some of that group was doing some education and stuff, I think, in the schools as well around that.
Perfect. You mentioned a couple local partners that library, senior center, housing. These all, are immediately sort of obvious to us as we get started with these, but are there partners that we might not know about, like nonprofits, faith groups, volunteer groups that might be important to the public health work going on here?
Yeah, so we do work with the Medical Reserve Corps in here in Grafton. Marianne in town is very engaged with that. There is are they a nonprofit, the group that we're doing with the opioid?
I think they are.
What are they called again?
Gap recovery.
Gap Recovery is a newly identified partner here in the community that offers recovery services. Did you want to add to that? And they do. We did a grant with them recently. I will say we've had really good partnership on the stuff with the ambulance committee and the first aid with the fire department. They've been super responsive to kind of help us understand what they're doing that maybe we could leverage. Police department as well, just based on their availability for doing things. So I do think we have, and they've also been involved on the opioid subcommittee. So I think, some of the usual suspects, they actually work really well across our different groups as well.
Beautiful.
Yeah.
And then I just have one more, trying to understand maybe what's been helpful in terms of communicating to the public updates from the board. Are there communication channels that have been really effective, or ways of messaging that have gotten communication out there in an effective way?
Yeah, so we use a variety of ways to communicate with the public. A lot of times it's through our website. We do have a social media platform, so depending upon how quickly we want people to get information, we might use social media to blast that out. Nancy in our office, who's on the line as well, would be the key contact for all of those things. We have, is it OnSolve? We also have the ability to send out alerts if there's something that we need to communicate to the community quickly, in addition to kind of what the broader state can do. That seems to be, most people in town seem to know how to get in touch with the Board of Health. And Nancy is sort of their first line of contact. And then if there needs to be an inspection, we use this meeting to sort of report off, if you will, to the public since it's recorded, and then meeting minutes are generated and posted to our website. So we have all those sort of typical open meeting requirements down with Nancy's support. So we use those channels as a vehicle to communicate public, and certainly, if we do have a hearing or things like that, we follow those channels for posting. We have also done, if we're going to have something like a clinic, like a vaccine clinic that's outside of a usual clinic at a housing place, or we do with Tufts, we do like a rabies clinic annually. We usually do try and put flyers in different places. So those modalities seem to be working to communicate with the public. Certainly worth assessing whether or not there are other modalities that the public would be interested in hearing from the board. But they seem to get the message when we send those things out that way.
Perfect. So I'm just going to bring this information back to the regional group, make sure we're continuing to build something that works well for Grafton. And I'll say shout out to Nancy. She's been super helpful already, and you have this great regional team. They're the stars. They're in the room there. So I'll turn it back over to them unless you have any other questions that I can answer.
Let me just check with any questions in the room for Connor or Redika. Any questions for him? Great. Nancy is our rock star in the office. We stay organized thanks to her very much. So thank you for all of your kind comments on her as well. And thank you for joining us today. We appreciate meeting you and getting to know a little bit about what your group is doing sort of in the background to support us as well.
Beautiful. Thank you so much. Have a good night.
You too. All right. Well, it's your turn. So we thought it would be great if you kind of each want to go around and just introduce yourself, your role at the new alliance. Have we decided on a name yet? I don't know that we decided on a name yet.
We did, yeah.
We
So
did?
I think we're officially the Central Massachusetts Regional Health Department.
Okay.
At our last group meeting, that was the decision there.
Regional health, great. So I think it would be great just, I know you probably did this at the last meeting that I wasn't able to join, for the kind of rest of the members of the board, just to kind of hear who each of you are, what your roles are, maybe a little bit about your background. I know some of you might be kind of new to an alliance thing, and some of you might have some history with that, which is, both are great. So love to hear from each of you, if you want to just go down.
Yeah, so I'm Annette Garcia. I'm the regional health director here. I started August 11th, so still figuring everything out and getting used to the role. I've been in local public health for about 7 years, just under, and have served a lot of various roles. So worked as a program assistant, I did inspections for a number of years, and most recently I actually come from being a shared service coordinator for another public health excellence grant group based out of North Andover. So it was 6 communities that we worked with together there. And similar to here, we had really varying community sizes. So I worked with as large as the city of Haverhill, down to the town of North Reading, which was about 13,000. So I think that's, a good translation to this group where, our community sizes are all varying in terms of how large they are, what their business infrastructure looks like. But I think that there's a lot of commonalities between health departments or between towns, and we hope that this regional health department can really capitalize on those similarities and provide, excellent services to each community.
Great. Can you just bring your microphone a little closer to you? You don't yell as loud as I do, I'm told.
Do I need to repeat myself?
No.
Or?
No, I think you're good. It picked up, but it's probably a little far away
Quiet.
from folks. It's just a reminder for you ladies on the end as well. Great. Any questions for Anna? Welcome. It's great
Thank
to
you.
see you. Thank you again for coming in person. It's
Of course.
quite the treat.
Happy to be here.
I'm Bridget Hurley. I am the regional public health nurse. I've been a nurse for a little over 10 years now. I have experience. I first started working in a community health center, went inpatient at St. Vincent Hospital. I worked there for many years. And then I did school nursing for a few years, got my master's in public health, and I worked for the Metro West Shared Public Health Services and Neshoba Regional Health Services before coming here.
Great. Welcome. Thrilled to have you.
I'm Mackenzie Falker. I'm the the only regional health agent right now. Hopefully, not much longer. I have my master's in public health as well. I've been a regional inspector for the last 4 years with the Leicester Regional Group. So I've been doing it a little bit.
Awesome. That's great. Thank you all. We always find too, when you all report things to us or you do your inspections, we are not necessarily the experts in all those things. So we ask questions to understand, kind of where different things came in or, what are the follow-ups from those things. So don't be surprised when we're like, how'd that go? Some of them are not unfamiliar to us, but sometimes we're just like, we're not quite sure. And your board composition here, we have a lot of different backgrounds. We have 3 physicians. I'm a nurse, but we've all worked in very different backgrounds throughout the healthcare system. And some folks have lived in Grafton for a very long time. Some of us are newer. So it's kind of, I think it's a nice mix. Karen, we have one more board member who has been on the board for, I think, 20 years. So she comes with a wealth of knowledge and experience from our community, as well as, of course, Nancy, who has been with our health department for a very long time. We met with our select board, was it last month?
Yes.
It all feels like it's going by very quickly. And we do that periodically now, which I guess happened in the past, and now we're kind of doing it so we can talk to them a little bit about what some of our priorities are, where any of our challenges are. And so, of course, we didn't know necessarily about all of you just yet. So what we said to them and we'll say to you is we understand we won't have every single thing in place right away. So we want to be patient while also making sure that we kind of continue to move Grafton forward with those things that we had started to kind of get back in with. But we also want to be a resource and supportive for all of you, understanding that you all come with rich backgrounds, but you're also getting to know our communities and the players. So just know that we're here to answer questions. We'll try and be as responsive as possible. We all do work, I think. So we try and be responsive. You and I will connect a little bit more for sure. So we appreciate the partnership, and we want to be supportive to make sure that we're as successful as possible. It's very exciting. I know this is something that has been thought about for a long time, and yet also happening very quickly, right? Great. Anybody for any questions or comments for the new team before we get into their updates? Great.
Thank you guys for joining.
Yeah. All right. So, quick kind of review of any inspections, the health and we modify this. It used to say COVID, flu, and all this stuff, and we're just going to call it the Alliance Inspection Health and Wellness Update. So whatever portions of the report you want to sort of give us highlights on. Historically, we'll get how many inspections have happened and things like that as well. But if you want to give, I don't know if you want to give nursing first and then
Sure, yeah.
inspections. Yeah.
So I pulled the data from MAVEN, which is a state epidemiology site. There were 3 diseases that had confirmed cases in Grafton. So influenza had 2 cases in August, corona had 7 cases, and norovirus had 2. Typical slight increase from the previous month of flu and COVID. Kind of the trend, I'm not getting daily cases, but I might get one, a week, either pediatric or adult case coming through of those. As far as West Nile goes, so the report I pulled was from the 29th of August, and at that time there were no human cases. There's now 3 within the state, none in town. I don't think actually any in our region.
Yeah, it's in northern.
Yeah,
North
Middlesex.
Mass. Yeah.
But so we partner with the Central Mass Mosquito Control Project, and they continue to monitor pools and provide designated street spraying after positive pools are detected. However, they will stop accepting residential spray requests as of the 29th of August. They're continuing to spray as necessary for schools, town events, and virus detections, though. So they're still monitoring all those for us. What else? There was one case of Vibrio up at Buzzards Bay. So there was an alert put out. I attend weekly epi meetings, so they're Zoom, and they're all the epis from the state. So the epidemiologist from there said it was a really great learning experience to see how people deal with things like that. It's not a common thing to see, but just to be on alert for that. And then with the measles activity, it is slowing down. Texas has determined that it's no longer considered an outbreak because it has been more than 42 days since a new case. And that's the CDC's recommendation as far as when an outbreak should end. As of August 26th, there was 1,408 confirmed cases of measles in 43 jurisdictions. Something just to keep on the radar, though, is that Canada is currently experiencing a measles outbreak. So there has been high incidences there. The case count and rates far exceed those in the United States. They've reported 4,638 confirmed and probable cases so far in August 2025.
And it looks like nothing in Massachusetts.
Yeah, still no. I think the closest to us was still Rhode Island,
Yeah.
Vermont.
Yep.
Nothing in New Hampshire. I don't think Connecticut either. I think it was just Rhode Island and Vermont were the 2 that were, and those were earlier.
Sure.
So nothing new has come up from those.
Right. Any questions? Great, thank you. And these, we do post these nursing reports on our website as well.
Okay.
We just do a little bit of a summary here for the group to be able to ask questions and give reminders to the community about vaccines are still available. There was an announcement, and of course, just the recommended precautions if you're not feeling well,
Yeah.
things like that. Inspections.
Yeah.
So,
Oh,
in
go ahead, Radhika. Sorry, go ahead.
I have a quick question with regards to, the vaccines. Does the Board of Health, provide any kind of vaccine clinics or, right now the cases are still very low. Do we typically do that? And if so, do we follow CDC recommendations, or with the current scenario, what is the plan?
Yeah, so we were doing vaccine clinics. I think we recently had one for folks that needed boosters, but also people that were up for sick. It wasn't only COVID and flu that we did. I think we did some other rounds of vaccines, so people were up for second rounds. Is that correct?
So we have one planned for August. I believe you guys are the 26th, that Friday.
September 26th, or we had one?
Yes, sorry, September 26th.
September.
We're not a certified vaccine site right now from the state because we're so new. So Worcester was the ones that they house their own vaccines. We don't have that ability at the moment. We kind of started at a funny time where it is high vaccine season.
Yeah.
It's just a process to get that going. It's on our list of things to look into and get going. So hopefully by next year. But we partnered with Shaw's Pharmacy,
Right.
and they'll be providing the vaccines at the senior center for a clinic for here in town.
And I think the guidance was in Massachusetts that DPH had some of their own recommendations for Massachusetts to follow. Is that correct?
That's correct. Yes.
Yeah, it seems like they're kind of they're doing their own thing where the vaccine will be available. There's been all this
Right.
news and people calling and asking would they be able to get the vaccine if their insurance didn't cover it, if they didn't fall under having a health condition. But Massachusetts has signed an order that
Correct.
the vaccine will be available and insurance companies will have to pay.
Right. So we'll follow Massachusetts guidance.
Awesome. Thank you.
Yeah, great question. Let's see. Anything else? Yeah. Inspections. Thank
All
you.
right. So yeah, for the last few weeks, I've done in town 26 food inspections, 1 housing, and then 11 nuisance inspections.
Oh wow, you've been busy.
A little bit.
Just
We
breaking
did
you
a-
right in.
Yep.
We
Jump
did
right
a
in.
body art inspection.
Oh yeah, that too.
Oh yeah.
And we attempted to do the inn
Oh,
as well, but that didn't happen.
Any for any of the inspections, any not inspections, but the sort of complaints, violations, any kind of repeat areas that we should know about?
A lot of the nuisance complaints were given to me by the building department, and I think a lot of it had to do with kind of like abandoned properties, and I think there was a little bit of confusion over our involvement with those. So I think maybe it's been clarified now, but
Yeah.
we're happy to go out anytime there's a complaint about
Sure.
anything, just to
Sometimes when pests start showing up, we start getting phone calls.
Yep.
Yeah. Yeah. And I think, and you may have already done this, but certainly a summary of what the inspections are to Nancy will be, and usually she'll try and give those to us. So we might have some targeted questions around, oh, we think we've seen this place kind of looked at a couple of times, what are sort of next steps? You'll see that you don't do the tobacco inspections, but you'll all see that as well when we kind of go down that path, that sometimes you have sometimes the same people are brand new, and a lot of times that's our conversation of is maybe re-education not working. If the same people keep having to call. Trash is a big thing, overflowing dumpsters, right? and pests
Yes.
because of that. Yeah. So that'll be helpful for us to prep as well. Any questions? I always forget to pause. That's why I'm trying to make sure I
Yes.
pause. All right. Thank you. I'm going to hand it over to you, Bill, on it's PEP, right? Is that how we call it? PEP?
Public Health Emergency Preparedness. And there are all these acronyms.
Yes, we
that
love
I have-
acronyms.
and I have not mastered them all. I did go to a meeting of theirs in Sturbridge about 5 weeks ago, and I went to another meeting last week. And one of the things that they had talked about was that they were
Sorry, we can
very-
hear
Into your microphone.
I'm
Could you-
sorry.
the mic closer. Thank you.
Do you hear me now? Okay. One of the things they said is they are requiring all their towns to perform a desktop health emergency activity, and it has to be turned into them by the end of the year, basically. This was received with great enthusiasm by everyone in the room because basically no one was in a position to be able to do this. I did, however, go to a meeting of the Grafton Emergency Management Agency last week and was delighted to discover that they had done a tabletop activity in June of this year, and they've been kind enough to provide me with their after-action report and improvement plan. Their plan involved 3 train derailments, which resulted in various health issues. And I forget the details, but they were done in concert with people in the Blackstone Valley, and they also involved Milford Regional Medical Center, which is now part of UMass Memorial, the UMass Memorial system. So my hope is that this is my out.
That
And I've already taken the initiative of emailing it to the person from the public health emergency people, preparedness people, hoping that in fact they'll embrace this as something. We were represented. Fire and police from Grafton were part of this process. I'm not sure how they or why they are kind of disengaged from us. You know, in the sense that it seems like we're going on in parallel tracks. But they clearly had this, it was funded, they had an outside consultant run it.
Wow.
I mean, when you read it's obviously fairly impressive in terms of being, very complete and so forth. Having never really seen one before, I was impressed. So my hope is I'm going to get a response from Pamela Masters, who is the person who is the PEP person,
It is Pepsi.
and that this will satisfy the requirement for this year. If that fails to occur, they did say that they would offer the possibility of a regional tabletop exercise that all interested communities could participate in, and that would be November 20th. I don't know if this is all something you've all heard about, or
Anything?
you're shaking your head. So so I don't know, but I was certainly happy to hear that they had done one.
Yep.
I did get invited to participate in their training program.
Oh, that's
so I'm
good.
going to be. So I felt obliged to do that if this gets us out of the.
Yeah, I mean, especially if there's like a biomedical type emergency, if
Yes,
they could apply
yes.
the same principles to
Yes.
what's already being done. And we are part of, like, our ambulance response is regionalized as well, so, and fire, so we'll call in other communities broader than the 3 with you all.
Right.
So I think that makes sense, that it kind of be part of something we have in the community and or part
Right.
of the regional.
Right. So my hope is that I'll get a response saying, "Gee, that looks great."
Wonderful. Great job, Grafton.
I'll soft pedal the fact that none of us knew about it or participated in it.
Well,
but
we'll know now, right?
we all know now. But at least Grafton was represented, and if we were to do it ourselves, we were to have fire and police involved and so forth. So I think. My uninitiated impression of it is that we're going to be okay.
Okay, great. Pamela's very, very responsive, I think, so hopefully she'll be able to guide us if we're not on the right path here.
Yes. The next thing on the list was the Grafton Opioid Recovery Community Partnership Update. This is the subcommittee we've set up in the last several months, and we've begun to spend some of the opioid settlement money that was given to each of the towns in the Commonwealth. We actually are ahead of where most other communities are. And I think the word is out that we are ahead because we had representatives from Middlesex County and I don't know, other municipalities that are not in our standard catchment area. But I think that they are actually, becoming much more active. They've had a couple of Narcan training episodes, one of which was quite well attended, had 30 people there. They also sponsored a vigil for overdose families. And next weekend, there's a wiffle ball tournament that we've been invited to participate in. Of course, they have no idea of how klutzy I am with the wiffle ball. But I think we are making some progress with that. And this organization actually has a recovery house in South Grafton, and a former member of our board, Dan Finn, discovered them. Of course, he's lived in Grafton his entire life, so he's well connected. But these people were flying under the radar as far as the rest of us. But I do think that it's going to work out, I think, quite well. It also coincided with the fact that they had funding from the Worcester District Attorney's Office that had been sunsetted, so they were actually looking to replace that funding, and the funds that we are able to provide them appear to be able to do that in a satisfactory manner. The ambulance update.
That'd be me.
I have some,
You have something?
Well, I have something that relates to that because at the Grafton Emergency Management Agency meeting, Todd
I was going to
Kramer
say,
was
I see
there.
our friend Todd Kramer is on here.
Todd Kramer was there.
Yeah.
And he is on the ambulance subcommittee. And he pointed out that he had met me at our previous board meeting, and he brought up the issue of a nursing care facility that we have in our community that he feels really is not up to snuff. I think they apparently get calls very frequently for things that are not really emergent.
Right.
And that's one of the issues. But he also has concerns that it's just not it's not a place that he would want his parents. I don't know what the oversight. This is a level 4 facility, so it's not a skilled nursing facility. It's basically a rest home.
It is a rest home.
And I've been trying to figure out what the oversight of that is.
I have that. So as I said to Todd at the last meeting, they are regulated by DPH. I do have contacts that I can connect him with. I just needed to come back from my vacation.
Okay. Good.
I took a vacation.
Yeah.
So I was back like last week. What I said to Todd was that we would connect him with representatives from DPH. Because his concern is really more about, especially with what happened in Fall River, the assisted living community with emergency protocols, whether or not they're required to have an AED, which they may or may not be. But they have ombuds and things like that, ombuds folks for dissatisfied residents. We have been involved from a Board of Health perspective for that particular location. It was more of a plumbing issue. So those are the kinds of things that sort of fall under us, whereas some of those other care concerns are under DPH. So what we told him last time was that we would connect him with a representative from DPH to be able to share his concerns, see if that might trigger somebody going out there. But I think we have to be mindful as well that there are some things that aren't over our oversight as the Board of Health. So that's what we had
Right,
talked to him about
right.
last time. And I know he
Yeah.
he does tend to bring it up in a couple of different locations to make sure that it's not lost.
I just thought
in
it
the-
was me, you know.
No. And
But-
they are a location
Yes.
that comes up with ambulances that they call 9. They're because they're not a nursing facility as well, but they're not an assisted living, so they have more clinical folks than an assisted living would, but
But
less than a
off
skilled
hours,
nursing.
they don't
Right,
have them, yeah.
right. And again, it's also, training and expectation and also de-escalating of clinical or non-clinical situations that might come up. So they were listed as one of the stakeholders to engage with our ambulance vendor
Yeah.
to talk about, different ways to kind of handle that. But there's also certain things we're not going to be able to force private entities to do.
Apparently, the DPH though certainly has less direct involvement with the level 4 facility than they do with the level 2 or 3 facility.
Level 4 is supposed to be able to take some of the higher people, so they should be regulated in the same fashion. So, we can look at that.
Which facility?
Crescent Manor. Yeah, I think that's the only rest home that we have in town.
Yeah.
Yeah.
It's a rest home. It's not a skilled nursing facility.
Correct.
So I mean, I was a medical director of a nursing home for 30 years. So when the DPH showed up, everyone was.
It's different than a skilled nursing facility, but they are regulated by
Yeah,
the DPH,
yeah.
and they do have higher regulations than like an assisted.
Todd's impression is because they had reached out to them because of the Fall River episode and so forth, and that they were not really that responsive.
DPH wasn't?
Right.
I might have some other contacts for him then.
Yeah, Well, no. I mean, I think
Yeah.
it's.
Yeah, like the payer side, maybe we
Sure,
can engage as
sure.
well. Yeah, because there's more oversight with them that could and should possibly be.
Okay.
Yeah.
So that's my overlap with the ambulance subcommittee update.
I had a feeling when I saw that here. Yeah, so with the update for
Yeah.
the subcommittee, as I said, we had to kind of pause some of that because we're going to be asking for funding from our town administrator likely to try and roll some things up so that, again, we have a clear sort of expectation for AEDs and first aid. We have a very long list of places we would like to do that in, but we really need to probably prioritize areas of greatest concern, like the schools, for example, the municipal center, the library, and then, looking at the areas that are maybe less populated but could still benefit from that. And it overlaps with the ambulance committee because Todd he was preparing a safety plan for the town, and then is also appointed to a new role in emergency management. And while our response times for ambulances are good in town, they could always be better, especially where we're in this sort of joint thing with other towns. And, we have addresses for where there's more and more calls and whether or not those calls actually result in an actual transfer to the hospital. So we'd like to try and bring some of those calls down by identifying what maybe unmet needs exist or what education there is. So Crescent Manor is one of them. There's some senior housing and other kind of housing locations, while also having to, protect HIPAA and things like that. We can't necessarily do resident specific, but we can kind of look at the community in general. And again, of course, our housing partners in town have some limitations to what they can and cannot do as well, but trying to identify what resources we can put in place. So like Todd had some examples for us at the last meeting we had, that some communities, if they were finding that the fire department was responding for falls and lift assist, maybe we get a grant to get some of the non-skid socks and hand those out in those communities, things like that, to try and curb some of those occurrences. So lots to happen on that. What I said at the last meeting was, once I was back from vacation, we have the list of stakeholders we wanted to have a meeting with the ambulance committee on, and put something together for Evan about potential cost of doing like a multi-service contract for multiple stakeholders in town, and hopefully again moving those initiatives forward. But we were on pause, as I said, for a little bit. Anything else on ambulance subcommittee? Ambulance, that's first aid subcommittee. Okay. I realized that I skipped over a very, very important point on our agenda, and that is to entertain a motion from one of our members regarding appointing Annette Garcia and Mackenzie Fokker as health agents on behalf of the Grafton Board of Health.
So this is Andrew Chalupka. I would like to make a motion to appoint Annette Garcia and Mackenzie Falker as health agents on behalf of the Grafton Board of Health.
Is there a second?
This is Bill Muller. I second that.
Roll call.
Andrew Chalupka, aye.
Bill Muller, aye.
Radhika Prabhu, aye.
Jen Maynard, aye. Welcome, officially. Okay. Any old or new business that we haven't covered yet before I go through? We have a few sets of minutes to do some motions on.
The reason I printed this out actually is there's a brief discussion of what their tabletop thing was.
Yeah.
I don't know if you're interested or not, but I'll give it to you to read at your.
Sure. I got the other report that's there.
Oh, right.
But
right,
yeah, this is great. Thank you.
This is more succinct.
Oh, perfect.
I have some for you guys too.
Sure, yeah.
So this is, Bill is just sharing with us the meeting minutes from the Grafton Emergency Management Agency, their tabletop discussion. Can we make sure Nancy gets a copy of this as well? So we'll add it to our materials.
I will.
Thank you. Super helpful. Okay. Now, for meeting minutes. We had no mail or correspondence this time. For meeting minutes, we have June 2nd, 2025, August 12th. Wait, let me think. Hang on a second. Can we do... Radhika, when did you join us? July? So we
July.
Okay, so we
Yeah.
only have 3 of us for June 2nd, so we'll have to hold off on that. But we can do 8:12 and 8:13. I can't even read 8:13, right?
Mhm.
I can't even read my own writing. But any discussion on the August 12th meeting minutes, which I believe is the one what we had with the select board, and then our meeting on the 13th, any discussion on those 2 sets of meeting minutes sent over by Nancy?
No.
Okay.
No.
Okay. Would anybody like to make a motion? You have to do them separately.
Go ahead. Okay. This is Andrew Chalupka. I make a motion to accept the minutes from the August 12th, 2025 meeting.
Is there a second?
This is Bill Muller. I second that motion.
Andrew Chalupka, aye.
Bill Muller, aye.
Radhika Prabhu, aye.
Jen Maynard, I see. Sometimes I just go on autopilot when I forget to speak.
This is Andrew Chalupka. I make a motion to accept the minutes for August 13th, 2025.
Is there a second?
This is Bill Muller. I second that.
Roll call.
Andrew Chalupka, aye.
Bill Muller, aye.
Radhika Prabhu, aye.
Jen Maynard, I. Thank you. We have upcoming meetings. I can't believe it's going to be October 6th, 2025. Remind me, were we planning on doing hybrid? We were going to try and do hybrid for that, or was this going to be our last hybrid?
I don't remember.
Come on.
I remember it was going to be a hybrid next one
Hybrid
as well.
next one.
Up until October.
Yeah, hybrid. And then virtual starting in November? Got it. Okay.
Yeah.
And then we have, thank you, Radhika. November 10th, 2025, and then December 8th, 2025. And we did set, I believe, Q1 of 2026. Don't know where the time goes. Any other last minute walk-on items?
No.
No.
Would anybody like to make a motion?
This is Andrew Chalupka. I make a motion to adjourn.
This is Bill Muller. I second that motion.
Roll call.
Andrew Chalupka, aye.
Bill Muller, aye.
Radhika Prabhu, aye.
Jen Maynard, aye. All right. Thank you, everyone, for joining us and looking forward to working with you all. We'll see you next month.
Thank you.
Bye.
Thank you. Bye.
Recording stopped.